Mic check. Okay, perfect. So Galen said, "Hey, can you come at 6?" And I would love to bring greetings. What I would say is that there's a lot that's happening in our country when it comes to healthcare, whether it's the ACA or Medicaid or Medicare. There's a lot of changes and transitions, and so what I would tell you is the most important thing is to understand one, what is happening. Number two, know where you can get the information. We have a lot of people here, whether it's Celebrate Healthcare or they're Enroll Virginia or the Virginia Poverty Law Center. There's a lot of information, so get plugged in. And more importantly, once you get plugged in, make sure that we tell every single person in our community. This is the most important thing. Healthcare is a human right. Let's make sure that everybody is informed. Thank you, ma'am.
Great, thank you. All right, thank you. So the reason why we do stakeholder coalitions meetings, and we do that in the morning with nonprofits, faith leaders, businesses, and organizations to start getting them up to speed on some of these changes in Medicaid and SNAP. And then we want to do these town halls, these town hall meetings to show the changes and how it connects to the community. And then we want to be able to hear from anyone who's on Medicaid or on SNAP on how this impacts your lives. And why this is important? Because we got a General Assembly session coming up. And we got to be able to put a face with a name. I mean, a face with Medicaid, a face with SNAP, and be able to tell these legislators, we need to have funding. We need funding in our SNAP, we need funding in our Medicaid, we need funding in our Department of Social Services. And so Deepak Mandela, who's going to come up in a little bit from Virginia Poverty Law Center, is going to give the presentation on the different changes from the big bad bill, as I'm saying. We're going to call it a bad bill because it really impacts our community badly. But we will be doing this throughout, the year. This is the same way we started Celebrate Healthcare, teaching people how to get into the affordable care. And then we was able to, after that, talk about why it was important to go vote in a nonpartisan way so we can expand Medicaid. And we have a lot of partners. So we don't do this alone. We have a lot of partners, so we come together as a coalition. I'm going to bring up Toya Sosa. Toya is the Associate Vice President at Riverside, and she can bring you greetings as well. She's one of our partners.
Thank you. Can we give a hand to Eileen again, to Gayleen again, because she has been doing these community forums for some time now, and she's doing such a good job bringing us all together so that we can collaborate and think of ways that we can help our fellow constituents. So thank you so much for allowing this forum, because it's much needed. Riverside is proud to be partnered with Celebrate Healthcare, and I have my boss here, so I would be remiss if I didn't introduce her. And I keep saying Gayleen for Eileen and Eileen for Gayleen. Eileen Varnson is the head of our communications team at Riverside, and then we also have Zuleika here. Zuleika actually qualifies our patients for Medicaid, SNAP, all of the different benefits. So very happy to have Zuleika here with us as well. But we are just, as a health system, really proud to be a part of this because our main concern is making sure that our patients have access to quality health care. And so if their benefits are getting taken away, being able to offer them alternatives is really the name of the game. So thank you again, Gayleen.
All right, thank you so much. So this presentation today is going to be the first of many on different levels, and this will be able to give you some information to take back on the importance of things that we need to do as a community, because it's going to take all of us to make sure that the recipients in SNAP and Medicaid are successful. Because if we have SNAP families start losing their SNAP, it affects what? It affects our public schools. It does. And guess who's going to pay for that? We are, and just like the thing with affordable care, we want to make sure that we keep the affordable care. We want to make sure we increase the subsidies, but we want people to continue to enroll, because if they go back to the emergency room, who's going to pay for it? we gonna pay for it, right? So it's all connected. So I'm gonna bring Deepak up, and Deepak has got a presentation, and I wanna see if the young man back there, you have to, sir, in the back, does he hear me? Oh, I'm so much, you got the presentation, right? Okay, hold on, we're gonna make sure whoever has the presentation. She's back there. They got it? Okay, good, good, good. I'm going to bring up Deepak Mandela. He is with Virginia Poverty Law Center. We have been working together since 2013 to roll out the affordable care. And he's going to provide you with the presentation. Let's give him a round of applause.
Let's do it from here. See the best way to see it while I'm doing it at the same time here. But yeah, thank you so much, Gayleen. Like she said, we've been working together about 11, 12 years now, trying to implement the Affordable Care Act. Last, 5 years ago now, is it now, for Medicaid expansion, has been a big, key driver of the safety net here in Virginia. And, with all of these changes, we have a lot to protect. And unfortunately, if you can go to the next slide here. So first, I'm going to just start talking about who I am. So I work with the Virginia Poverty Law Center. We're based in Richmond, Virginia. It's been around since late 1970s as a resource for first legal aid attorneys. So we work with all the legal aid programs throughout the state, providing training and assistance to those programs. But then we also implement programs like Enroll Virginia, where we partner with programs like Gayleen's here in Hampton Roads and other programs throughout the state to help provide direct services for people who are trying to apply for benefits. We do that both for SNAP and Medicaid and ACA. Next slide, please. So why are we here? So unfortunately, last year in July, the one, OBBA, of what it's called, I'll call it as HR1, so we don't have to use that term, did make some big sweeping changes to some of our core public benefits programs. So the ones we'll focus on today are Medicaid and SNAP. And I'll talk a little bit about ACA as well, but focus will be on Medicaid and SNAP. These programs are cornerstones of our safety net. And they introduce things like work requirements, impose new eligibility restrictions, create very significant administrative burdens. We'll definitely take a moment to talk about that because our DSS offices are already overburdened, but the new stuff that's coming down the road with HR1 are going to make that look little, and we're very much worried about how our local offices can handle this extreme burden that's coming their way. And then the last point there too, it's not insignificant there that they're shifting big portions of the costs of these programs onto both the state budget and local budgets. And we're talking billions of dollars for these programs. So next slide there. So the one thing I'll focus on, because these are very big programs and they're making big changes, we'll focus on work requirements. That's something that Gayleen and I really do feel like, especially this year, is going to be critical because people have to do a lot of things to comply with these new rules, and it's going to happen in a very short amount of time when they have to learn about it and then take steps to keep their benefits by meeting new work requirements rules. So next slide, please. And feel free to stop me throughout this presentation if you have a question or need a clarification on any parts of it, because SNAP especially and Medicaid as well are both complicated programs, and because I work in it, sometimes I go into jargon, and so please stop me, and I'm happy to explain that. But so what's coming? I'll do the overall, and then we'll focus in on the work requirement piece. So like I said, it's going to cut nearly $200 billion from the overall SNAP program nationwide. And how are they doing that? They're doing that through, one, making a lot of immigrants ineligible. So we're not talking about illegal immigrants. So undocumented immigrants have never been eligible for these programs. What they're doing is they're actually removing a lot of legal immigrants from eligibility for these programs. We're talking about refugees, asylees, other legal immigrants are now no longer will be eligible for some of these programs. We'll talk more about this. Expanded work requirements started last year in November for the SNAP benefit. They're lowering the monthly benefits as well. They're doing that by changing to the allowances for utilities, cutting something called the Thrifty Food Plan. That's how they calculate the amount of the benefit. They're making changes to that. And also they're making changes so that the reductions will continue into the future, unfortunately. And then like the last I said there, they're shifting the cost burden. So previously, federal government would pay for most of the benefit. Now that's going to be shifted to Virginia, and it's not a small number. As you can see there, the cost, they're estimating between $260 and $350 million per year of new cost to the state. So it's very, very significant. So next slide, please. Okay, so now we'll go to work requirements. So SNAP work requirements are not new. We've had work requirements for SNAP for a very long time. It started in 1996, what's known as the ABOD rules. That's able-bodied adults without dependents. Sometimes they'll call it ABOD. And it just kind of says, you know, if you're must be working or actively engaged in work to receive SNAP benefits, unless you meet some type of a waiver or an exemption, right? And if you don't do that, then you can only be limited to receiving SNAP benefits for only 3 months over a 3-year period. So that's kind of that limitation. And before I get any further, something important to note with work requirements is they don't actually work. So it's really important to understand that. They're not really ever been proven to encourage people to seek work. What they end up doing is making burden on individuals applying for those benefits and keeping them off. So that's how they make cuts. It's paperwork, right? Most people on Medicaid, most people on SNAP are already working, sometimes multiple jobs, right? So what these types of requirements do is they have to jump through hoops, right? They have to go to the right office, fill out the right paperwork to keep those benefits that they already could have got otherwise. So that's kind of how they, you know, make cuts to these programs. And that's kind of what's happening on Medicaid especially. So, you know, we're not defending any of this, but just kind of explaining what is changing, unfortunately, with our programs. So next slide, please. So these are what's changed to these ABOD rules. So what is it meaning if you are able to be, you know, like some of the the waivers to some of this. So if you look on the left column there, that's what it was before the bill, and what's in the second column what's after the bill. The first line there is really critical. They increased the age of people who have to meet these requirements from 55 to 65. Right? So if you're between the age of 56 and 65, you now have to meet these new work requirements. Previously, those older adults were exempt from the work requirement rules, right? So a lot of older adults who may now have trouble getting jobs to meet some of these requirements. Another one is they reduced the age of household parents or residing in a household of taking care of dependents. So it used to be under 18. They lowered that number down to 14. So now they have to be 13 or younger.
So, let's clarify. So if the person is, if you have a 15-year-old, both parents have to work?
Yep, there's now have to meet the work requirement, unless they meet another exemption. But yeah, that by itself, they no longer will meet that exemption. You have to have a 13-year-old or less to qualify, to not have to be meeting these ABOD rules.
So if you have a mother or father who's to stay at home, you have one working, both of them have to work.
The way the SNAP rules work is it's each individual will qualify for the benefits, right? So the child still potentially could get the benefits, and the working adult, but the household would still be based on that. So it still would have the work requirement. Yeah.
So now, what is the reason, the rationale for number one, where it's under 18 or 65 years or older, as opposed to the 55 years?
Yeah, they're making cuts. So this makes it so people in that age group now have to meet the work requirements, right? And many may be unlikely to meet those requirements, so they'll lose the benefits, right?
So before you had to be 55
Yeah, another question? Yeah, and we'll talk more about like what it is to meet the work requirements. So there is a lot of ways people can meet these. So right now I'm just starting with saying who's subject to these work requirements, right? So for charters, they'll have to meet those requirements. If they're 63, 64, 65, unless they have another exemption, they will need to meet those. And we'll talk about what it is to meet the work requirements, right? Mentally or physically unfit for employment, that's another still there. But another, you can see this is another one, big ones that cut. No longer being homeless is an automatic exemption from work requirements, right? Being a veteran is no longer an automatic exemption. Individuals who were in foster care at the date of 18 also is no longer an exemption. These all previously were automatic exemptions to the work requirements. The one thing they added was certain Native Americans are now some automatically exempt. Okay, so next slide, please. Another big change, and this is impacting quite a few localities in this area, is that some localities who had high unemployment rates can get broad-based waivers for that geographic area because there's high unemployment, not enough jobs to meet the work requirements. There used to be 2 different criteria to meet that broad-based waiver, right? One is if that locality has an unemployment rate of 10% or higher, right? The second one is that if a locality did not have a sufficient number of jobs for people to meet the work requirement. No Virginia localities that don't meet the top one because we don't have that high of an unemployment rate, but many of them did meet that second criteria and did have that waiver. And I kind of listed the ones on this slide here. And you'll see, if you go to the next slide, I put it actually on a map for us to see. And you'll see that all of that kind of in the Emporia broader region there, all of those counties have now lost that waiver. And so this is really important because this is the first time they're having to implement work requirements in these communities in a very long time. And so that's, even for those local DSS offices, it's a new thing for many of those workers because they have not had to do work requirements because they had broad-based waivers. And so we're particularly concerned about that because, you know, even in those regions, these offices have high caseloads. And so we're worried about errors because there's a lot to do with reporting these work requirements, and so it's just kind of a newer thing, unfortunately, impacting some of these communities. Yeah.
I'm gonna need to carry with her. Is the reason why maybe some of these I'm sorry. Is the reason why some of these localities were waived, eliminated, was because some of these areas that I know of, that now they have casinos in that area?
No, it's not because of that. Nothing changed with the perception of those specific areas. It's just that there's no longer that criteria that's available. That lack of jobs allows you to get a waiver. They got rid of that in the HR 1. It used to be there's 2 options and a state could apply for those waivers, and we received waivers for those for a long time because these are localities that still have relatively high unemployment rates compared to the nation overall. And so that's something that was a state could submit to the USDA, who administers this program, saying, you know, yes, it's not 10%, but it's still a very high unemployment rate, and the availability of jobs is low. And so that's why these localities were granted those waivers. And so that's kind of a big change now because you're talking about those blanket waivers, like for people who are homeless, veterans, in localities that have high unemployment rates, there's no longer these automatic waivers. So now all of that process becomes more of the standard way where people have to meet either the ABOD rules or other work requirement rules, right? It just adds more kind of paperwork or burden to the overall system and for these people that probably they all already will meet those requirements. That's what's important to understand here. They are all probably working, they all meet the rules, it's just now they have to, it's not automatic for them to qualify for the benefits. They have to go through some more paperwork or hoops to qualify for that. Okay, so next slide, please. So now we'll talk a little bit about just how do people meet these work requirements. So now they might be subject to them, right? They're these what we known as ABOD rules or work requirement rules. The first thing to know is there's actually 2 work requirement rules in SNAP. They don't make it easy. SNAP is very complicated. The first thing is called work registration requirements. And so this is broadly for, it involves more people than just people who are considered ABOD. These are people who are physically or mentally fit to work and are over the age of 15, under 60, must register to work, accept job offers, and cannot voluntarily quit or reduce their work. So people who are ABOD also will be subject to these. They'll be subject to both. But you can see this is broader than just that. They have to, they consider registering when they go and apply for SNAP benefits, the DSS office. And you'll see what this is mostly having to do is you have to just comply with the registration, seeking work. If you've offered a job, you have to accept it, that type of stuff, right? Cannot voluntarily quit or reduce your hours, things like that are tied to this work registration requirement, right? This is not changing. If you go to the next slide there. So these are the ABOD rules, right? So people who, in those categories that don't have all those waivers now, so those folks between 55 and 65, now if you're able to work, right, you have to work for cash or in-kind goods services for 20 hours per week. That's like 80 hours per month. You can participate in an employment service program that's offered by DSS. There are specific training programs they'll offer that they can join. There's also other, there's volunteer programs, work capacity programs that the DSS can arrange. And that's all available, but you have to meet, most people with ABOD will have to meet some of this using a combination of these different programs to meet that 80 hours per month or 20 hours per week. Any questions about that? All right, so the next slide on that. All right, so we'll stop there. If you have any other questions on SNAP, I'll transition to Medicaid. All right, so we'll go into Medicaid. So one thing, Medicaid is a little bit different than SNAP because one thing is that SNAP changes are already in effect. Those that was on the passage of the bill. Many of them went into effect, and then many of them related to kind of the work requirement went into effect in November of last year. Medicaid has not changed significantly yet. It's coming soon, very soon, this year, but that's part of the challenge because it's a big change to Medicaid because we don't have work requirements in Medicaid. SNAP does, so they could make some small tweaks to their system to comply with these new changes, but Medicaid has no work reporting requirements. So they have to build it, and they only have, the bill passed July of last year. They still don't have all of the guidance from the feds on how to implement this. And so this incoming administration will have maybe 10 months to have this up and running. And in terms of big eligibility system changes, that's a blink of an eye. Usually they'll want 2-3 years. And even then, we all know how Obamacare rolled out. They sometimes need a little bit to work. So we are very nervous that we're gonna need a lot of help to make sure people understand where they need to go, how to comply, because it is going into effect. States like Virginia have asked for extensions, but they're very unlikely to get it from the federal administration.
Let me ask you, let me be clear. Work requirements for adults in Medicaid expansion.
That's right.
Just Medicaid, not Medicaid, only Medicaid.
That's right.
And can you explain to them what Medicaid expansion is?
Sure. So in Virginia we have when we're talking about like Medicaid and FAMOUS. So there's 2 programs that provide health coverage to a lot of people, right, in Virginia. I think it's now to about 1 in 4 Virginians receive health coverage through either Medicaid or our CHIP program, which is the FAMOUS programs. So start with, I guess, so Medicaid itself has historically covered the older adults, people with disabilities, pregnant individuals in Virginia, children, right? Those were the kind of the core programs that have been covered in Virginia for a very, very long time, right? What expanded just in the last few years was for working adults, right? Those folks that previously made too little to qualify for the Affordable Care Act, were not offered employment through the work. So that's where Medicaid expanded the program so low-income working adults that don't have an offer of coverage through their work can get health coverage through Virginia's Medicaid program. And it's covered a lot of people. So that's where this new work requirement is going into place. So for people who are on programs that cover pregnant individuals in Virginia, children's programs, the older adult programs, disability programs, those will not have these work requirements. This is specific to the Medicaid expansion program. Any questions?
How that affects, let me just say this, how that affects is that if you can have a job, you can still get Medicaid expanded, under the Medicaid expansion. If you're a part-time student, you
Yep.
fall under Medicaid expansion, and that all
Yep.
goes away, then you're gonna have to work.
Yeah, right. And like with this changes to SNAP, this is kind of an overview. There are eliminating eligibility for many, many legal immigrant statuses. So unfortunately, some of our refugees, asylees, other non-citizens who are here legally are going to lose access to benefits. And so that's where, partners like our free clinics or health centers are very much trying to figure out how to expand their capacity, because we're anticipating that's going to be their only place, unfortunately, to go to. For no reason at all, the third bullet there, they're increasing the number of times you have to redetermine eligibility. Right now, it's an annual redetermination of eligibility, and already it's a huge burden for our local DSSs and the people enrolled in these programs. They're now moving it to 6-month redeterminations from 12-month. So they're going to double the amount of caseloads just on the Medicaid renewal piece. And then, new restrictions on how Virginia can even pay for these programs. Next slide, please. Okay, so the Medicaid work requirements are going to be implemented on January 1st of next year is when it'll start. So, not yet. This has not yet been implemented, but they'll start kind of rolling out some of this stuff this fall, and then it will be implemented on January 1st. And it's still that case. Like, I put this slide together, back in November, and states are very much still waiting for guidance from HHS on how to implement this thing. So they still have to build it. They're already building some of these things and trying to figure out because they need to, but they're also still waiting for guidance on how to do this. So we're very worried about how messy this will look. But those two qualifying pieces there, we're pulling that directly from the bill's language. And like SNAP, they're talking about 80 hours per month. It could be a SNAP-defined work program. It could be community service, part-time education, or a combination of these activities. And you can also meet this by earning at least $580 per month, or averaging that out over 6 months for kind of seasonal workers. So you can still meet that. So next slide, please. They have not. They are, my understanding with at least Virginia, they are trying to make this as automated as possible. So when they do have wage data, they do have hourly data, that they're going to just make it automated. So they have the systems, they can just check it, and people are good, then they don't need to ask them about it. But community service is the one thing that's going to be difficult to make that automated. And so what they need to show that they're doing community service, what it would be, the number of hours, it's still very much a thing that we're kind of waiting for additional guidance on. So these are the required exemptions. These are the exemptions that people would be in Medicaid expansion, but could be exempt from these new work requirements. And again, some of these things like this come straight from the bill's language, and we don't have as much guidance or additional information explaining what some of these terms mean. But for that first one, this is actually going to be a big category because it's broader than I think even other categories are about. Because it just says it's parents, guardians, caretaker, relatives, or family caregivers of a dependent child age 13 under, or, that or is important, a disabled individual. And they didn't define disabled individual. So these are some of the parts where I know for sure that I've heard from people in Virginia and DMAS are looking at this to define this as broadly as they can. So as many people can qualify under some of these exemptions and not have to meet the work requirements. But for some of our kind of clinics or providers, this is going to be important because this is where even looking over that medically frail category, right? This is for people who are blind, disabled, have a serious or complex medical condition, can be very important to get waivers, but how that's getting implemented, we're not sure yet. But I guarantee, I'm pretty sure that providers will be a key part of that, whether it's just through forms, right? Filling out forms, they can turn it into DSS, or if it's something more automated to where they're able to, if they're billing certain codes on their Medicaid reimbursement, then they can flag it as being eligible for this waiver. Some of the other ones on here, it's, if you're pregnant or receiving postpartum coverage, you're a former foster youth, recently released from incarceration, you're already meeting SNAP or TANF work requirements, that also is a waiver here. And veterans with a disability rated as total also would be a exemption from the work requirements. All right, next slide, please. Yep, go ahead.
Good evening. If they already have a medical waiver, say for a child, would they have to reapply for the waiver? Or will they automatically roll over?
So for this, like you're talking about for like a Medicaid waiver
Medical.
Programs,
Right, medical waivers.
it's very likely they would be able to get that straight because that would probably qualify, but again, this is where we don't have those details. But it's very important. I think what Galen's doing is important just to kind of get the word out because the time frame we're going to get, once we get this information with probably the new administration, it's going to be very small. It's going to be maybe months to where we'll have the website that's set up or the forms that are set up that everybody's going to have to go through and figure out how we're going to meet these work requirements. But I think that likely will be an easy way for a lot of family members or parents who have kids already on waivers to know that they are meeting that exemption. That's what I would think. But there's also some optional kind of short-term hardships that they're talking about, and again, some of these are a lot of medical related. So if you're receiving inpatient hospital care, nursing facility services, and other type of similar services, that would get you a kind of temporary exemption from these work requirements. Emergencies, they do have a high unemployment rate exemption here as well. And then the last one too could be an important one in Virginia. It's also traveling for an extended period to access medically necessary services. So we know a lot of people travel, particularly to go to like UVA and VCU in Virginia. So that could be an important one. But again, we don't. This comes straight from the bill. We don't really know what that means. Like, what is extended period? Is it a distance? Is it a time? Or is it because you're somewhere? Like, a lot of this stuff is, it's difficult. The states are trying to implement this, but there's not enough guidance from the feds for them to know what these terms mean. So stay tuned on some of that. So next slide, please. So states are going to be required to verify compliance with these new work requirements, both at application and renewal, right? And for at least 1 month prior. So the difficult thing here is it's not just looking forward, it's looking backwards too. So when someone applies for Medicaid now, they're going to be looking at least 1 month prior to the application. So a lot of people come to us and to Galen and to Allison over here to apply, and they're applying for Medicaid because they lost employment, right? They lost their job and they lost their insurance. Right now, Medicaid's a really important kind of bridge coverage for them. They can get onto Medicaid, have Medicaid for a couple months, and then when they get back in employment, they can turn the Medicaid off. Now that this new requirement is going to make that a little bit difficult, right? And I've talked to some of the hospital partners, and they're very nervous about this because they see the same thing. That when people kind of may end up in the hospital, they may have lost insurance through job loss, and that's when they can apply for Medicaid and get coverage. Now there's this new kind of look back period. Like, have they been working? Are they meeting the requirement for last month? And whether that'll delay enrollment, right? They may have to wait that month to then enroll. And whether that's enough or whether they're already subject to the waiver. And if the waiver goes to previous month. These are questions we still don't have answers to, but it is true that the requirement is both at application and during renewal periods. So. January 1st, 2027, yeah. And then they did clarify in here too, so if you don't qualify for Medicaid due to the work requirements, you're also not eligible for tax credits to the marketplace. So just because, if you're found ineligible because of that reason, that's not gonna then allow you to go to the marketplace to get the coverage. Yep, the ACA, exactly, yep, Virginia Insurance Marketplace. Yeah, because a lot of people right now, if you're found ineligible for Medicaid because of eligibility rules, then you can go to the marketplace and get coverage through that method. Yeah, next slide, please. I think that's. So the last point, kind of changing topics a little bit, but it's all related to this, is that, so I think about a year and a half ago now, a consulting firm named BCG did a study on our Medicaid program. But the story, what they looked at was actually at why were so many applications delayed? Like, as you can see here, nearly 21% of these are non-age blind disabled. So these are like Medicaid expansion, children's application for Medicaid, taking more than 45 days to process. 45 days is supposed to be the limit. But 21% of applications in Virginia were taking longer than that period. So this study kind of looked into, well, why is that? Why is Virginia having such slow applications? And it's a similar story in SNAP, right? Only 19% reviewed within 24 hours. Only 13 of 120 meeting their goal of completing 97% of applications timely. And that, starting with the next bullet point, it kind of tells the story of what's going on here. And it's not really the fault of the local DSSs. That's what really is the story. It's one, we're using very old technology. The systems that they're forced to use are like 1990s early technology that they've just been putting tape on it here, adjusting it here, work around here, and now it's become almost unusable for some of our DSS workers and other people within that system. Next slide, please. And then also, I'll go back to it, but you saw that high vacancy rate. So in Eastern Virginia, I think they're seeing between 23, 25% vacancy rates on the open positions. So who is working there, there's extra caseload. And so, from 2017 to 2024, caseloads went from 198 to 415, and in the last several sessions we've been talking to DSS office, they're talking about 800 to 1,000 now. So we've expanded programs, which is a great thing. Our safety net has very much gotten better. In Virginia, we've expanded Medicaid. There was an expansion in SNAP to make that eligible to more people. We've made great strides in some of our pregnancy programs, but we have not kept up with our systems and the people working to help people enroll in these programs. And this is already the case. This is before HR 1 has even started. So we're very nervous and talking a lot to leaders about thinking about the impact of this and how we can be ready for these changes and how people are actually experiencing some of these programs. Because we hear from clients all the time that they're trying to just these are complicated systems and programs. SNAP is complicated, and they're trying to meet work requirements, but they've got multiple jobs, taking care of kids, and they can't get through to their caseworker. And then they get frustrated, right? And it's all the time, throughout the state. And we know what we're learning is it's not the caseworker's fault, right? One, it's not even a highly paid job in Virginia. And so there's a lot of a lot of turnover. Walk on the door, you have 800 cases. It's just not fair. So that's kind of what we're really thinking about right now in the short term of how we can just prepare for some of these changes and supporting the staff that are going to have to deal with this on the front line. So next slide, please. So implications overall. We need to increase outreach and education, which we're starting to do here with these type of programs. Many people are unaware of these changes. So there's a real risk of people not complying just because they don't know about what they're supposed to do. Our system uses a lot of mail, postal mail still. And as we know, we have very bad, the postal service is slow. And so oftentimes they're getting notices of when to respond to things after the deadline's already passed. And then they're trying to contact their caseworker and they can't get through to the caseworker. So it's just, you can see, people are just kind of doing a lot of unnecessary stuff right now, and it's, they're not at fault of not doing these things right, but they're missing deadlines and they're losing benefits. And so that is a real risk. The high administrative burden and workload, losing coverage, not meeting hours, and the interconnectivity of these programs. I think a lot of people may not know this, that if people don't have high enough SNAP enrollment rates or Medicaid enrollment rates, that's directly tied to school funding of both the school meals and school Sunbucks programs. That if a community has a high enough number of people enrolled in these programs, then they can get waivers. And so then when kids go to those schools, they don't have to then apply for school meals every year, which we used to. A lot of schools had to do that. But when you have a high enrollment, the school can say, oh, everyone's qualifying, we can exempt the whole school. And we don't need to add that burden, and then more kids are getting meals without having to do more applications. And there's a similar kind of waivers with WIC and LIHEAP as well. So yeah, next slide, please. I think this is the last one. So I also wanted to just put this slide together. I think we're going to be sharing these slides out to everyone. There's a lot of information that's going to be coming through from our state agencies in the next months and weeks as the new administration comes in. And so I wanted to put these as the kind of the places to start if you have questions or where to go. First one is for SNAP. Our Department of Social Services at the state level is going to have a lot of information on how to meet the work requirements. And there's also on there how to contact your local agencies as well. You can find where your local agency is and how to contact them through that website. For Medicaid and FAMUS, Cover Virginia is the website that you'll want to go to, and they'll have information about Medicaid and all of those programs and how to apply and how people can get help. So if you go on that website and you do there's a find local help tool on there, it'll direct you to assisters throughout the state who can provide direct assistance for people navigating the Medicaid program. And the last one is the Affordable Care Act, the Virginia Insurance Marketplace. And that's a good place to go to because they have a website there that people, yes, they can apply and search and look for the kind of the marketplace or the Obamacare ACA plans. But when you do an application on that website, actually, they're also checking everybody for Medicaid and FAMUS as well, right? And so if you're qualified for Medicaid, they're going to send that person over to Medicaid and enroll them, oftentimes directly, without having to do any additional steps.
Can you explain to them, because all you hear right now, the subsidies are going away and all the prices are going up higher. Can you explain what the difference is with the subsidies?
Sure. So when people go to the ACA marketplaces like the Virginia Insurance Marketplace, and many may not even know what I'm talking about here. So the Virginia Insurance Marketplace is a new thing. For a long, long time, Virginia was using healthcare.gov. So that's the federal website that many of us know, have known for a long time now. It's been around now for 13 years. But so Virginia, about 3 years ago now, 2 years with the new website, transitioned to our own state-based marketplace. So Virginia took full control of the ACA marketplace, and that's now called Virginia's Insurance Marketplace. And so if you go to marketplace.virginia.gov, that's where you would go, and you can do really 3 really important things on that website. One is, it's the place you can go to shop for plans for individual people looking for individual insurance. You know, before the ACA, it was kind of the Wild West, and you'd have to know what companies were selling in your area to know what to go. So sometimes you're just kind of searching around. So if you go there, you'll see, okay, this is, type in your zip code and you'll see, okay, these are the 3 plans or companies that are selling insurance in my area, right? That's one thing. The second piece is that it makes it really easy to apply for assistance. So when you apply on the website, you're gonna put in information about your income, your household size, where you live, and before they even show you the plans, they're gonna show you how much you qualify for in financial assistance, right? And there's 2 types of financial assistance that's available through the ACA. One is premium subsidy assistance, so it's gonna help lower people's premiums. The second one is it's going to help lower the deductibles and co-payments and out-of-pocket costs. So there's special plans, there's these silver plans that are lower cost on there. The third thing is it's just an easy way to get help too. So the Virginia Insurance Marketplace has the tool on there where you can type in your zip code and it'll pull up navigators like our program or brokers or assisters that are all certified by Virginia to provide assistance, because we know it's thankfully no longer the case in Virginia because of our new marketplace, but in other states there's a lot of fraud in kind of online shady brokers and things like that, where people are calling, they get in touch with them, they think they're talking to someone here in Virginia, but no, they're somewhere else, maybe Florida or Texas, and they're not selling them an insurance, they're selling them something completely different. But if they're going to this website, everybody they find on there when they're searching is certified by Virginia that they've been trained and that they're working with plans here. So what changed? So as part of kind of during the Biden administration, what we think is they fixed a lot of the affordability issues with the Affordable Care Act. So when it first passed, they did a lot of really great things, but there was a few kind of glitches with the affordability of the program. And one of them was that for higher income people enrolling in plans, they were finding that if you had income above 400% of the poverty level, you didn't get any assistance. Even if you lived in an area with high insurance costs, and a lot of places in Virginia do have high insurance costs. I think Williamsburg is one of them here. You would get 0 assistance. And it wasn't just 0 assistance. As soon as you had $1 over 400%, you would lose all of your assistance. So if you started the year okay, you had 300% of income, but then, we saw this all the time with sometimes retirees or people close to retirement would have a tragedy of some type, or a home improvement need that needed to happen, like needed to replace their roof or something. Well, they would take money out of the retirement. Guess what? That was all taxed, right? Pulling out of retirement, it would put them over 400%, and then they inadvertently would lose all of their tax credits. So that's a glitch. We thought that was a good fix, right? Now instead of losing all of your credits, you would just lose some of your credits, right? You'd still be eligible. That all changed, and so now what we're seeing, and then they also lowered the amounts. So how much you were required to pay, they adjusted it down to be actual what we thought was the right amount, the right reasonable amount people should be paying for insurance. All of that expired at the end of last year. And so now that's when people are talking about, I'm seeing these huge increases. Well, yeah, that's because those enhancements or those fixes they made during the Biden, those all expired. And so we're hoping they come back, because we're having to talk to a lot of people who are turning down insurance altogether because they're just seeing their rates go from, $50, $20 last year to $300, $400, $500 for per person this year. They can sometimes make ends meet because they'll switch to plans with higher deductibles, but then they're facing high deductibles. So and you're talking $12,000, $10,000 deductibles, and that's, it's difficult, right? It's difficult to make that choice. Yeah, go ahead. Okay, I can
Well, yeah, what is it then that we as citizens, what can we do to really try to combat that? Because I think it's just a really sad situation because as our younger people, teenagers get a license, the insurance is so high you can't even afford, families can't even afford it to help them get a good start on either working or going to school. Is it any body of people we can talk to see how we can get those insurance rates down, or some kind of way to have a statute of limitations on what those insurance companies can do? I think it's so unfair.
You can pass that over to Delegate Shelley Simons.
Yeah, I'll definitely pass it on to someone who wants to talk about how to advocate on that. But the first thing I think is important on this too is that we do have folks like Allison, like who are navigators. I think first thing is that there still is a lot of assistance available, at least here in Virginia, because we still have Medicaid expansion, fully funded, still available, and while subsidies have been cut for a lot of people, they still are available. And so a lot of people are still qualifying for some assistance. And so it's helpful to first check, because we don't want people just turning away and saying, no, it's too expensive, it's all gone. We still hear from people that, I thought ACA was gone a long time ago. It's no, it's still here. Especially in Virginia, they've funded it and they're supporting it. We have our own marketplace. They're doing a lot of work to try to make things as affordable as they can. So there are options. And so I think first looking at what options are out there, and then we're still working on that. Then we want, we're trying to get their stories. So what is the story? A lot of people are having to make tough decisions right now, and so we're encouraging them to share their story with their local leaders and their things, because those stories are really important to be heard. Yeah.
Let's give Deepak a round of applause. Deepak, you can have a seat up here. I'm going to bring up Angela Futrell. Come on over, have a seat over here. Angela Futrell is the CEO of Southeastern Virginia Health System, and I'm going to bring with change here. Come on with Riverside. And they actually work with the SNAP Medicaid. And I'm going to ask them a few questions, and you might have some questions as well, because we want to be able to put a face with these issues. We know that the biggest problem is going to be, well, not to say problem, let's say opportunity for us. It's the paperwork. It's going to be really, really bad, because they got to do it twice a year. When Medicaid is going to have to recertify twice a year, we know that people are busy and all of that. But one of the things I want to ask Angela, and I'm sorry, I've just met her tonight. Huh? Shaleka? Zuleika. I want to ask you all, what do you see with your clients? Can you tell us some of the impacts that you'll see, how this is going to affect, how these changes are going to affect them? Good evening. Here you go, use that one. Here you go. I'll turn it on.
Good evening, everyone. I know what we're already seeing due to the losses of coverage, Medicaid coverage, is that people aren't going to the doctor. They're just not going to go. Or they're going to have to make the harder decision to go to the emergency room. So what we've worked so hard throughout the years to get people to have established health care, a medical home, they're not able to do that anymore if they don't have health care coverage. So we don't want to go back. We want to keep moving forward. We want to continue to improve health outcomes. We want to continue to decrease the disparities, especially among populations of color, so that we just get healthier. So that's what we're seeing already from some of our clients that have benefited from Medicaid expansion, that they've lost their coverage. And so what does that mean for someone who had insurance and now you don't have it anymore? Even if it's Medicaid, whatever you might have had, that means you can't get your medication. So what does that mean to have a diagnosis of diabetes or hypertension and you can't get your medication? Then if they need to go to specialists, they can't go see the specialist because they don't have the coverage. So we're already seeing some of the devastation that will be caused rolling out already.
Thank you so much. My team and I, we actually work in the clinical setting. So we are seeing these patients firsthand. We are seeing the patients that are having strokes because they do not have access to their hypertension medication as well as to their insulin because the cost of insulin has gone up. One of the biggest concerns that we've talked about internally is with the loss of access to health care, that patients will begin to use the ED as a form of primary care. And what we do understand that is when people lose access to health care, they lose access to their quality of life. And so we're going to be gearing up for sicker patients that have longer length of stays. And the access of health care is not only about losing your insurance, but this bill also is creating a hindrance for your clinics and hospitals in rural areas, particularly those that may have to close down that within a certain radius. So we understand that people are going to even be more critical when they're coming in because they may have lost their literal access to health care because those clinics and those hospitals are closing down. So one of the things that we have been trying to figure out is to see exactly, what can be done. Luckily, Riverside does have a charity care program for people that may not qualify for Medicaid. But one of the things that I think is very important to consider, because there is a growing population of people that are working part-time, but because their hourly wage is so high that they also do not qualify for benefits. So just to put that in perspective, because we talked about Medicaid expansion for those individuals that are between the ages of 19 and 64. So if you are a single individual as of right now with no children, you can't gross more than $1,800 a month to qualify. So if you have a job that pays you $20 an hour and you're working at least 30 hours a week, you do not qualify for health insurance through your company, you are still ineligible. So we're looking at those things as well because people literally will have to choose between to earn a living versus getting health insurance. And so there are a lot of factors that we're looking at, including the immigrant populations, because we see those populations in our hospitals as well. And so there are a bunch of concerns as far as with the refugees and asylees, and even with our pregnant moms that are considered to be immigrants or undocumented, because we do have specialty programs for famous prenatal, and we know that funding is going to be cut in those areas as well. So it's just a great big concern overall, and we're just monitoring policy as closely as possible in hopes that there are some solutions that will be provided for those populations.
So I'm gonna try to lighten the air a little bit. So I was telling my coworkers today, my colleagues, I was saying, look, we have to stand up and say something. It's affecting our community. It's affecting your family members. I told my colleagues, I said, look, because if my family members don't have health care, they're going to call and say, well, can you loan me some money? I don't have any money to loan anybody. So we need to stand up and advocate for our communities, because it's devastation. As I said, that means that your quality of life, which means we can't have productive citizens. They have to make a decision. You already know about child care. Child care is ridiculous, and that's a whole nother topic. We need to do something about affordable child care so that when parents have to go to work, they don't have to make a decision between going to work and staying at home because you can't afford the child care. So we have to be our advocates for our patients, for the community, for your family members. Please advocate.
And I believe that we do have a delegate here tonight. And I just want to bring this topic up because because I know you gave a wonderful presentation, but one of the things that we are also concerned about is long-term care. Medicaid is the largest payer for long-term care, and that includes nursing home, and that also includes community-based care. And so when we're thinking about budgets and things of that nature, that kind of coincides with that, about what services can be available to people that choose to remain in their home. They're not ready to necessarily go into a nursing home, and things of that nature. So I know that we do have a representative, a delegate here, but that is something that has to be under strong consideration as well.
Thank you. Thank you. That's very well. We have Delegate Shelley Simons with us, and I'm gonna have her make some remarks, so you can have a seat when you get done. But there you go.
Thank you.
Let's give her a round of applause.
Thank you for that question. I have seen in budget proposals a real focus on elder care. It does seem that the Trump budget has cuts to home-based care that are very concerning, because we know that it's actually much more cost-effective and actually healthier for seniors to be able to stay in their own homes. That has been the policy of the United States and Virginia for a really long time. One thing I will say is I have been impressed. My colleagues on the Appropriations Committee are very committed to looking at the gaps in healthcare funding caused by the Trump budget. A lot of the healthcare cuts we know about. Some of the cuts to education we actually don't know about yet, or they take effect in a few years. For example, we were talking about the universal eligibility for school lunch. I'm really concerned about that, because I don't think in our budget we are taking that into account yet. And part of that is it hasn't taken effect yet. So a lot of these things, it's going to be really hard for us to build a good budget, because we just don't know when these cuts are going to start impacting. But I can tell you, every school in Newport News right now has this universal eligibility for school lunch. So every kid has access to a free school meal. What's going to happen with some of the immigrant families when their benefits get cut off and they no longer have meals available to them at school? It's just terrifying. So one of my colleagues is introducing a bill that I hope everybody can get behind for universal school breakfast. And if we can get some funding for that, I think it's really going to help be a buffer for our students, because even if they lose that school lunch, at least Virginia will be providing that school breakfast. Thanks.
What about, can you talk about a little bit about Medicaid and SNAP? I know that's a big.
Yeah.
Is there any talk about that in the budget?
So I'm on the Finance Committee, which deals a lot with tax revenue and how we raise money, but I'm not on the Appropriations Committee, at least yet, that deals with how we spend money. But I did go to a retreat 2 months ago where we talked about cuts, and I believe they think the budget impact is going to be about $2 billion to the Virginia budget. And in terms of money that we've got to work with, we really have less than $1 billion available for new spending. So there are some potential sources of revenue out there. We've got data centers. I'm sure you all have heard a lot about the growth of data centers. People are talking about potential taxes on data centers. That's a source of revenue. Another would be if there is marijuana retail sales, that could be a source. But to make up for these horrible federal cuts, we're going to need a whole lot of revenue to get that done. One last thing that when we had a budget presentation really bothered me is, and this was Governor Youngkin's presentation, in the beginning, they showed a graph where corporate taxes had, collections had stagnated, and then at the end of the PowerPoint, they showed that corporate profits were way up. And I was like, why on earth have our collections stagnated, but yet the revenue is up? So that's the kind of question that I'm going to be asking on your behalf, because I want to make sure that big corporations are paying their fair share and that we're not just relying on everyday taxpayers and payroll for the budget of Virginia.
Do we have any questions? We do have a question right here. Okay, question right here. You got a question.
All right, good evening. I did have a question. So I know I heard mention of advocacy. Just wanted to know, where can the citizens go about, or where would it be effective for us to advocate? In Richmond, you know, like where do we?
You mean the General Assembly session? Well, let me just say this.
How do we go about
On
doing
January the 20th, the NAACP is going to have an advocacy day for the state. So I have information for that. I can get your information. And you want to come and meet us up there, we'll be advocating for a lot of this on January 20th. It's advocacy day. You can learn the process. A process for that one. Because we have to advocate for these bills. And if you want to learn the website, on Sunday, we're going to have, this is my other hat I'm putting on, we're going to have a pre-legislative session on Zoom, and that's at 7 o'clock on Sunday. And we're going to talk about the legislative session, and we'll have speakers, and then we'll talk about the process on how a bill gets passed. And so if you want information, if we have your contact number, we'll send you the link so you can register.
Just wondering, and I appreciate your efforts, Gayleen, and all of your speaking, and the people from Riverside. I'm wondering if there's somebody here from the city, social services, community services board. Seems as though that needs to be the front line in terms of getting this information out regarding the changes in Medicaid, regarding the SNAP benefits.
Yeah, they were supposed to come. And
they're not here?
They had, no, they were going to come. And it was
But they're not here?
It was a mix-up. It was a mix-up,
They're not
but they were
here.
going to come. No, they were going to come. They were very supportive. They're very supportive of our efforts, and they were going to come. Let me just say this. Working in social services is a thankless job. They have anywhere between 800 to 1,600 cases. So, and they get told off all the time because people are frustrated because they don't answer their phone calls right away, and they can't do that. And what needs to do, which we're advocating for, is that DSS needs more funding. They need competitive salaries. They need to hire more folks. They're overworked. They're leaving. And we need to develop a pipeline from our colleges into DSS. And so those are some of the things. I'm on the Governor-elect's Health and Human Resources policy team. And those are some of the things I've been advocating for, along with some other initiatives to help with paperwork and all of that. I'll talk a little bit later. We have a question right here. Wait a minute, go ahead. Mm-hmm.
Good evening. Good afternoon, everyone. As a person who's on the front line in healthcare on a day-to-day basis, seeing 10, 20 seniors, dementia is hugely on the rise. And I think you mentioned something about the long-term care being cut, and they've got these great programs where if someone needs to take care of their loved one, they can get paid to do it, so they don't have to go to work and put them in a nursing home. How is this expansion program going to impact those people? I guess the question is for you. Is it Deepak?
I mean, yeah, this is Deepak. I think the big implication in programs like that is that, you know, like Simmons talked about, is there's so much cuts that are coming to Virginia. The shift of the cost to Virginia on all of these programs is so large. It's going to be difficult not to make, unless there's more revenue. I mean, it's just they're squeezing it. They're squeezing all the states here, and those programs are not, unfortunately, what are known. We think they're all required. They're essential programs, absolutely, but they're not in the Medicaid world. They're what known as waiver services or like optional services, and so those are the ones that are on the, like they're there, but there's going to have to be people to fight for those, right? For the waiver slots too, right? Those are already really difficult, and so, and that's the challenge, right? And that's why there's got to be advocacy, because either that, or just got to find more money, or reverse the cuts in DC. I mean, that's the other side of it too. It's like it shouldn't have even happened in the first place, and so it's putting they're saying we're not cutting anything. We're not cutting anything, but they are, because they're shifting it to the states, and then the states have to make these hard decisions, even if they want to support it. Virginia's doing we're going to be better than most states for sure, but it's still going to be difficult.
Am I? Good evening.
Wait a minute, the Medicaid starts on January 1st, 2026.
Good evening. I'm from the Hampton News Community Service Board, and I work at the Four Oaks Day Center also.
Can you put the mic closer to you?
Is it on? I'm from the Hampton News Community Service Board and the Four Oaks Day Center. I'm off the clock. I'm here just advocating for some from the population that I work with. Thank you all for coming. And what I do know, we have received some proposals from HUD that is devastating cuts towards the homeless population. Those cuts are going to be extremely devastating to a lot of areas that service these population that I work with. We're talking about individuals who will not qualify for a lot of services because they're not, the proposals that we receive, they're not getting benefits from Social Security. So they will automatically be cut. There are so many individuals who have disorders who have not been qualified through Social Security services. So we know this is going to be an impact on the hospitals also. Because crisis stabilization services, we know that's an ongoing issue. For me, I just wanted to advocate because that's the job that I do. But for Delegate Simons, one of the things I'd like to say is that before the Medicaid expansion became, because there's going to be some issues coming down the line that we see for the next couple of years, if they can bring up the proposal again of the Governor Assistance Plan, which was considered the GAP program, that program covered a lot of services for individuals at that time that did not have any health insurance in the area that met those criteria. So I would definitely like to see that we can get a lot of help for individuals who suffer from a lot of different things that's going on with individuals in the community. So I don't know what an agency is. I just came to advocate for the clients that I work with. Thank you.
Can I speak to? Hello, good evening. My name is Tawana Ruffin, and I'm from Hampton Department of Human Services, Social Services here. So, so one of the things I wanted to mention when you're talking about getting the information out to our clients and our communities, all of our workers, we've been telling our clients about these changes since last year. As soon as we found out about the changes, we're telling our clients about the work requirement, about the verifications, because there were changes that went in effect on October 1st, and there are changes that went in effect on November 1st. So every time there's a change that's coming down, we're telling clients. And what we know that's coming that's not even posted yet or listed, we're informing them constantly of other changes that are coming down the pipeline. So we're just trying to get them prepared. But there's also a lot of exemptions that they're going to be eligible for too, especially when it comes to the Medicaid. If you have a medical reason why you're unable to work, then that can also help with your Medicaid, because the work requirement is going to be, the work requirement for SNAP and Medicaid are going to be very, very close. So if you're exempt for SNAP from the work requirement, then 9 times out of 10, you're going to be exempt from that Medicaid also. But like I said, as far as the workers, even though, like Aileen said, we have caseloads
galore, like in the thousands, and we are doing multiple jobs. One worker is probably doing like 4 or 5 things, and it's hard to return phone calls, but we're answering emails, and we're definitely trying to get everything out there as timely as possible, but we're getting the volume is so high, and there's so many changes every time you turn around. With Medicaid, it's like a change probably about every 30 days there's a new Medicaid. And our system, we don't even want to talk about how our system barely works. So the system is just not working sometimes, and it's spinning, and it's just, we have to call in tickets, and then there's a different way to do all of this. So it's just a lot of work. But when I say we're getting this information out and trying to prepare our clients as much as possible about what's coming down, not trying to scare them, but just trying to prepare them about what to expect. That's the only thing that we can basically do, and hopefully it's enough, because there are going to be some major changes. And we've been telling them this since last year, and it's going to be some changes that we're not even prepared for.
And what I was saying, thank you, and we thank you for what you do. I mean, it's like being in the military. We thank you for your service.
A special place in heaven for you.
I want to say that it's our job to speak up for DSS. We've had representatives at almost every one of our town halls or coalitions from there, and the stories that we've been hearing coming out the office, that the work, it's a thankless job. It really is. We should be thanking every social worker. I'm telling caseworker. We should really be thanking them, because they bend over backwards to make sure that they help, but they need more help. But it's up to us to speak up and get them the resources that they need to be successful. Did we have a question over here? Yes.
How do we know where the money is going to? Like, they're making all of these cuts. Where's the money going to? Like, you know what I'm saying?
So we said it's on a federal level. Did we start there? It's on a federal level, and let me just say this. 90 million people didn't vote in 2024. All right, 90 million. So that if the couch was on the ballot, it would have won the Electoral College and the popular vote. That's where the money is going, because who you got in office up at the White House right now? So they're the ones that's making the cuts. So that's why voting is so important. And I want to thank everyone in this last election who turned out, because we sent a message, and we have an administration right now, and we have a majority in the House and Senate that's going to make some difference. But they can't do it right away, because it's going to cost so much money. It's going to cost a lot. You have one question here? And then I got a couple comments, and we're going to wrap up.
Yes, Pastor GP, I pastor a church in a historic neighborhood of Hampton, and we recently renovated our church facility, and we're envisioning what would it look like to host health fairs and to provide health screenings in collaboration, because every week I'm getting these phone calls, and we're overwhelmed with what we can do and who we can't help. But if we collaborate together as a community, how much more can we do? And so my question is, how can spaces of faith and churches collaborate effectively in this season to help our community thrive?
Well, that's what we do. That's exactly what we do. We collaborate. We bring everyone, we bring our resources together. And let me just put this plug in. On January, we do a lot at the churches. We do a lot here. January 16th, we're going to be at the Hampton Roads Convention Center from 10 to 3. We're going to have all kinds of health screenings, flu shots. We're going to have workshops. One workshop is going to be, I'm in my 60s, now what? And it's going to be about, doing your finances, your health, your living will, and all of that. And then we're going to do a SNAP and Medicaid town hall at noon. We're going to have STEM for the children. We're going to have a lot of activities, and we have one over in Norfolk. But we do a lot, and we can do one at your church as well, too. It does. Thank you. And that's Jennifer Brooks, and she's the president of the Newport News NAACP. Yeah, you could do it. And we're going to have, if you have a sign-up sheet, put one up the front. It's Tuesday, January 20th. We can use one of those blank sheets and have people to sign up for it. Then I can send them the link for that. I'm the political action chair for the state for the Virginia NAACP. And so I'm actually organizing it, and we're having a reception afterwards with the governor, because she'll be governor then, Abigail Spanberger, and with Lieutenant Governor Ghazala Hashmi, and with Attorney General Jay Jones. We'll be having a reception afterwards. So we'll send all that information out for Sunday. We're going to take a couple more questions, and then we're going to wrap up. We're going to hear from the head of this household over here, too, for a minute. I want you to say some words there. Go ahead.
Hi, everybody. My name is Edward Harley. I'm a disabled veteran, and I currently work for the U.S. Forest Service as a grants management specialist, but I actually have a background. I worked previously with Centerra and Riverside. And to piggyback on what you were saying about the NAACP for January 20th, being that this is mainly about healthcare, I wanted to share some other lobby days that we did not speak about. So specifically, Virginia Nurses Association, their lobby day is also January 20th. Virginia Council of Nurse Practitioners lobby day is January 27th. The Medical Society of Virginia's lobby days are January 21st, January 28th, February 12th, and February 26th. The Virginia Hospital lobby day is January 22nd, as well as the Virginia Surgery lobby day is February 26th. So for all the healthcare concerns, please make sure not only advocating with the NAACP, but please advocate for the specific places that you want to also advocate for on those specific days. If you have any questions, if I was moving too fast, please come back and talk to me. Because even though I currently work for the Forest Service, I have a very deep background in healthcare, and it's very important to me as a disabled veteran.
Great. Well, thank you. Well, we're going to definitely, we got to get, what city you live in? What city you live in?
I live in Newport News.
Newport News. Oh, he is? Okay, you got a, where's President Brooks, do you have a veterans chair? Do you have a veterans, a military veterans chair? Okay, well, you might have another member over here. Let me just say this real quick, because we're going to have to wrap up. We're going to have to wrap up, and I want to bring up President Johnson. I want y'all to walk out with a few things. Number one, we know the SNAP age went from 18 to 14. If a family member, if a family has children over 14 and under 18, they'll have to work, okay? We know that if you were 55, before you had to work, if you were on SNAP up to you were 55, now you have to work until you're 65. You know, I also want to say with the Medicaid, when we talked about Medicaid, it starts January the 1st. As Deepak said, before you could do 3 months retroactive, now you can only do 1 month. Okay, 1 month for that. That's devastating. And the paperwork, you'll have to apply for your Medicaid and recertify. You're going to have to do it twice a year, every 6 months. The system was set to fail, but we ain't going to let it fail. You know, we've been through hard times before, and that's why it's important for us to come together as a community and figure out how can we help have ambassadors in our churches, have ambassadors in our organizations, and help people walk through this paperwork and remind them when the dates are to turn it in on time. We already know that the post office is not going to postmark the same day. We already know that. So what can we do as a community? So we'll be doing workshops with that as well. One of the things I said on the policy team, why can't we treat, and I know you have to have privacy, but why can't we treat helping people with paperwork like we do voter registration and do the training? Because if you do a voter registration drive, you got to do a training, and you have to sign that you're not going to do anything fraudulent. And so why can't we treat it like that? And so those are some of the things. The other thing is, why can't we bring retired social workers back? They came up to me, and when I'm on a lot of forums, and they said, we'll come back and help people with their paperwork. Well, they got institutional knowledge, so you want them to come back. You know, so it's ways that we can bring people, you know, to help people with their paperwork. And if we work together as a community, and I know that the volunteer hours, through the coalition meetings, breakfasts that we have, we learned that the nonprofits cannot handle really all the volunteer services, because everybody needs volunteers, but they can't handle the paperwork to track it. You know, so how do we find the pools to help people with their paperwork? How do we help people with their find jobs so they can fill the 80 hours a week? And how do we get guardrails to make sure we don't have bad actors? You know, so those are the kinds of things that we want to start. We've been talking about. I know social services has been talking about it, but as a community, we have to say this is real. This is real, and these changes. And so we'll be talking more about it. We'll be having more of these town halls. We'll be having work sessions. We'll be going up to the General Assembly, and we got to make sure that we advocate and turn out and vote, because this is the reason why Virginia is going to be in a much better place than other states are going to be because of this past election. Did you have one more question or something? Go ahead. We'll take one last question. Oh, you will have one. Well, so let me just say this. Everything now is still a work in progress, okay? Because what we don't know is what we don't know. There's certain things we do know, but we will get a fact sheet out. But this administration hasn't gotten in yet. And so when they come in, you're going to start seeing changes. You'll start seeing things. I know the communications will be better. We'll have talking points. We'll have FAQs. We'll have things to disseminate. Right now, we're just planting the seed. We're just planting the seed so we can grow, and we can just go. And the more people that we talk to, and you talk to your family and your friends and say, look, this is important. We got to get this paperwork in on time. We got to fill these work requirements hours, and we got to talk to our legislators, and we talk to our elected officials to see if we can bring change to make our lives better, and that's what we need to be doing, you know, with that. So I'm going to are we good? Everybody good? Let's give our panel a round of applause. All right, Deepak, thank you. He came down from Northern Virginia to talk to you all, okay. And I want to bring up Dr. Tremaine Johnson, who is the pastor of this church.
Hello, everybody. Thank everybody for coming out. Thank this panel, certainly for the information shared. And I just want to say this. A lot of times we're reactive, but we got to be proactive in this season. Definitely. Sometimes we don't react until it affects us, and it's right now affecting us, and we've got to tell everybody. The internet was crazy for the last week and a half over somebody's dress. So if we can talk about that, we certainly can share with others that we are in need of taking care of not only ourselves, but those who come behind us and those who are before us. So places like this and information like this place should have been filled with a lot of people, but we don't talk about it until it's the last minute. So we've got to start doing that now. Planting seeds is important, but you also have to water it, and you got to keep telling it, keep saying it, because this is happening right now. And you got to start thinking about who's going to be next in office, how you're going to get the rest of your family to vote, what you are going to do in a couple of years. Not wait until then, but start doing it right now to talk about what it means to be important enough to get up and vote while you're talking at Thanksgiving and you're full. You know those conversations you have after you have sleep? We need to talk about voting and what the world looks like, and Christmas while you're getting those gifts and while the tree looks slimmer. We talk about voting and how we can make a difference. We haven't figured out that we have the voice, but if we never get up and say anything, we silence ourselves. So we've got to start talking about this in the grocery store. I was telling Jennifer that my mom was a social worker, and every time she went to the grocery store, somebody was telling her, well, how do I do this? Well, how do I do that? Well, how do I do this? And she could not get to the cash register. She would send me into the grocery store so that she wouldn't have to be bombarded by people in need. And it is like that right now, that people have a lot of questions, but we got to start figuring out how we can answer those questions and help each other And stop waiting on the news folk to tell you everything. Read something, research something, and you don't have to use ChatGPT to figure out how to make a flyer. Figure out how we can make a difference in the world. That's what's going to happen right now, and we can use our resources to do that. So let us do that as a people, as a church, as people joining together with one another. It's not about just black, white, red, yellow, green. We all in trouble. And we need to recognize that right now. Right now, this administration is thinking about themselves. Who's going to think about you? If you don't start speaking up, you're going to wait for somebody else to talk for you, and it's going to be too late. Let's start doing that right now. Whoever's hosting it, whoever's bringing it together, let's not let, denomination, let's not let party affiliation to divide, figure out the information so that we can get the help we need right now, because we're the voice of the people, and that's what should matter.
Thank you, Dr. Johnson. I do want to make one small correction. When I said 90 million people didn't vote in the country, they didn't. But Virginia did vote the right way. Let me just say that. We did vote the right way. But that's important. But this information, and we'll be sending, if we have your email address, we'll be sending out updates. We'll be sending out, as soon as we get things, we'll be sending it out so you can have that. But right now, it's just about getting people prepared for what's coming, or what's here now and then what's coming. But more so when you talk to someone and they say, well, this don't affect me. Yes, it does. You may not be on SNAP. You may not be on Medicaid, but we're all connected, and it affects all of us. And so if you understand how that works, that's why you want to come with us on the 20th and all these other dates we have here. But if we have your information, we'll keep you up to date on a lot of things. We have a lot of events. Allison is our navigator, Allison Flowers, who helps us with insurance, everything with that. And so I hope you all are good. I think you're ready to roll. And let's share this information, and we'll be having some more. And if you come out and join us at our health fair that we'll be having as well on January the 16th at the Hampton Roads Convention Center. Have a good evening. Thank you so much. Bye-bye. Thank you, y'all. Dr. Johnson, get a picture of the phone.
If someone came in the back door or the side doors and they did not sign in with us, please do so that we can stay in touch with you.